Good morning, everyone. Thank you so much for joining us today for the 2021 Medicare updates training. I am going to introduce Sheri Smith, our regional coordinator. She has a few. Good morning. So Sheri, if you are ready.
Good morning, everybody. I just wanted to say a quick hello. Thank you for all that you're doing. I hope that everybody is safe and well during this time of pandemic. I know this is going to be a weird open enrollment period for everybody, but please know that your site coordinators and I have been working very hard to make sure that everybody's got what they need to get through all of this, and everybody's available to help you. So I want to wish you all good luck on a successful open enrollment period, and thank you again for all that you're doing. And with that, I'm turning it back to you, Melissa.
Thanks, Sheri. Well, good morning, everybody. Thank you so much for joining us today for the MAP update training, our 2021 Medicare updates. Today, we're going to go over the changes for next year. We're also going to touch base about the Part D Senior Savings Program, which is the insulin savings program, as well as how to do any uploads to ShipTools, how to save documents as a PDF to upload to ShipTools, and more. We ask that you save your questions until the end for us. And then this is a recorded webinar. So if you prefer asking your questions when we are no longer recording, we will make sure to let you know that we are done recording ahead of time so that you can ask those questions then as well. We did upload 5 handouts today for you guys, and I hope that you were able to grab those before the webinar started. If not, please rest assured that your site coordinators will get those to you after the webinar today. It's just the slides that we're showing you this morning, as well as some more specific info on that Part D Senior Savings Model and the tutorial that ShipTools posted on how to do those cost share savings. So we're going to go ahead and get started here. So Part A and B premiums. We currently do not have that information. It is announced in usually early December, late November, when the COLA information comes out for those that collect Social Security. So once we have that information, we will certainly pass that on to you guys. We'll send you a new blue color job aid, which has that Part A and B info. All right, and then what's new to the Medicare New Book? So for 2021, they have in there a page that goes over a few new things that are in the Medicare New Book. First thing is the Part D Senior Savings Model. It's the program for Medicare that helps lower the out-of-pocket costs on certain insulin medications. It's on page 84 in the 2021 Medicare New Book, but some specifics on it for you guys. The Senior Savings Model is not available to beneficiaries who are receiving LIX extra help. That is because they're already receiving a cost savings on their medications. However, if you have somebody who's not on LIS extra help and they take insulin and their medications are on that insulin list, you certainly can filter on Medicare's Plan Finder to view the Part D or Medicare Advantage plans that are participating with this Part D Senior Savings Model. In your toolkit, there is also in the front pocket the stapled papers that say Part D Senior Savings Model insulin meds. So it's the list of all those insulin medications that are covered under the program. The companies that offer this program in Region 1B are Align Senior Care, Blue Care Network, including the HMOs, the HAP Senior Plus, that would be the HMO options 1 through 2, the PPO options 1 through 4, Senior Plus, and Primary Choice Medicare HMO, Humana Gold Plus HMO, Priority Medicare Value HMO, Reliance, both Cardinal and Principal plans, Paramount Elite, Enhanced and Prime Medical HMO, Erickson Advantage Plans, and Zing Essential Wellness. All of this information is a part of those slides that we're going to send to you guys later this afternoon as well, or if you grab them off the handouts, all of those plans are listed in the notes of the slide. So don't worry about writing all that info down. It was more so just a piece of info for you. In terms of ESRD and stage renal disease, for 2021, there is now coverage for beneficiaries that have ESRD in terms of Medicare Advantage plans. So for more info on that, you can go to page 59 in the 2021 Medicare New Books. Likewise, acupuncture is now a covered service. So Medicare will provide coverage for acupuncture if the beneficiary has chronic lower back pain. Medicare will cover up to 12 acupuncture visits in a 90-day period. And more info on that is on page 30 in the 2021 Medicare New Book. All right, in terms of Moon, nothing new. Nothing has changed with that, so it's still the same. If they're under observation status in a hospital, that care is going to fall under Medicare Part B. If they are admitted in the hospital, it will fall under Medicare Part A. The main issue is that if somebody is under observation and they need to be sent to a skilled nursing facility, Medicare will only pay for that skilled nursing facility after a 3 full day stay in a hospital as a hospital admission falling under Medicare Part A. So make sure that the beneficiary knows if they have to go to the hospital that they need to receive their Moon status or verify that their admission status is either admitted or under observation. Same thing with the Medicare home health care, no changes there. In Michigan, there must be a pre-claim review. So the beneficiary must be homebound and the home health care must be medically necessary. Everything is conducted at the provider level. There's nothing required of you. But this is really important because Michigan had previously identified home health care as an area with a high instance of improper payments. And so they wanted to make sure, Michigan wanted to make sure that that wasn't happening anymore, which is why we have the pre-claim review and the medical necessity. Levanta, okay. So Levanta had replaced Kepro about a year or so ago. Michigan falls in Region 5. So if you encounter anybody who needs assistance, they need an appeal reviewed, complaint, if you need somebody to help advocate on their behalf, that would be Levanta. And they can be reached at 1-877-588-1123. Again, that's 1-877-588-1123. If you have any questions on Levanta, please reach out to your site coordinator. We do have more information on them as well. Healthcare Marketplace and Medicare. So Marketplace and Medicare are not designed to work together. If someone becomes eligible for Medicare, they can drop their Marketplace plan in favor of Medicare. If someone does not enroll in Medicare and they keep their Healthcare Marketplace plan, they will lose their tax credits for the Marketplace, and they may also be penalized with a late enrollment penalty when they choose to enroll in Medicare, if not having done so when they were initially eligible. We're going to take a look at the fall timeline. So in September, early September, Social Security Administration did a review of LAS beneficiaries. And then in late September, the annual notice of change and the Medicare New Books were being mailed out. Folks should have received that information by now. If they haven't and they need a Medicare New Book, please let your site coordinator know. We can get those mailed from our Oakland office out to beneficiaries. In October, on October 1st, marketing began for Part D season. The 15th, which is on Thursday, open enrollment begins. And then we'll also start to see those star ratings. And then in late October, we'll see some non-renewal mailings go out and the LIS redetermination notices going out. In late November, we'll see the COLA announcement as well as the Part A and B premiums. Again, that could happen also early December. And then on December 7th, open enrollment ends, which brings us to January 1st when plan coverage begins for any changes that took place during open enrollment. All right, in terms of mailings, Social Security, again, will start to send out those redetermination letters in September. If they've been deemed that they lost their coverage, that should go out then as well. For CMS, any reassignments, consistent poor plan notices, LIS choosers, Medicare and U-Books, those are going to be sent between late September and October. And then for the plans, any marketing materials, annual notice of changes, and plan non-renewals will be sent out in October. And just in terms of the plan non-renewal, for everyone to be aware of, Journey RX plans, there was 2 of them for sure, I know in my counties, but Journey RX plans are not renewing as of next year. They are no longer going to be a Part D plan option. So if you encounter anybody during open enrollment who has Journey RX for 2020, they will need to do a new enrollment for 2021. Otherwise, they will have no coverage. There is no plan that they can just automatically roll into for January 1. Okay, so let's look at the enrollment periods. So there's not a continuous open enrollment period for Medicare's Part D drug benefits. Beneficiaries, of course, have that limited time frame to enroll, disenroll, or make changes. The 3 enrollment periods that we see are the initial enrollment period, so 3 months before their birth month, and 3 months after when they're first eligible for Medicare. Open enrollment period, of course, October 15th through December 7th each year. And then special enrollment periods, which would be based off circumstance. So if they've moved, if they now qualify for LIS, if they've had a loss of coverage, things like that. There's also, though, a low performing plan special enrollment period. So if someone is enrolled in either a Part D plan or a Medicare Advantage plan with a less than 3-star quality rating, CMS will notify them through letter to tell them that they're in a low performing plan and that they'd be qualifying for a special enrollment period. This special enrollment period allows them to switch into a plan that has either 4 or 5 stars. So they do have to pick a plan that goes up. It has to be a 4 or a 5-star rated plan. Again, CMS will notify those beneficiaries through a letter. So there's nothing that you would have to do on your end. As long as they have that letter, they would be able to change at any point. Medicare open enrollment period. So this Medicare open enrollment period began in 2019, where anybody who has a Medicare Advantage plan effective January 1 each year can utilize the Medicare Advantage open enrollment period. It takes place January 1 through March 31 each year. A person can switch their MA plan. They can switch back to original Medicare and get a Part D plan. The only thing that you can't do is have a Part D plan and switch to a Medicare Advantage plan. If they want to switch from Part D to a Medicare Advantage plan, they need to do so during the open enrollment period, October 15th through December 7th. For those that are dual eligible, meaning they have Medicare and Medicaid, or if they have LIS, there is a special enrollment period. They have the opportunity to switch once per calendar quarter. So the calendar quarters are January, February, March. Then you have April, May, June, July, August, September, and then October, November, December. There is issues for those that might be considered at risk. So if you have a beneficiary that has medications that consider them to be at risk, they may be denied the opportunity to enroll in a new plan. But that's not something we'll know. So if we switch them and they get denied, there's a reason for it, and that will be notified to them. All right. Medicare Plan Finder reminders. In order to do a personalized search, it will require the beneficiary having a mymedicare.gov account. We absolutely want to encourage people to make a mymedicare.gov account, more so than ever this year. If we're doing phone counseling and they want to see paper documents before they make a change, that will require more than one counseling session. So having that mymedicare.gov account will allow you not only to see if they have LIS eligibility, but it'll load their current plan for you so you don't have to search through the plans. It will also allow you to maintain their current drug list so that you don't have to enter in all those meds all over again. When they create that user account, you can put their username and the password hint into the client contact form on ShiftTools. Please do not put their password. You need to put their password hint. So if their password is their favorite color, red, 1234, you could put in there in the hint, favorite color, 1234. And then they will know, it'll trigger them when you're plugging that information in to say, oh yeah, it would be red, 1234. You also can currently view 2020 and 2021 plan data on the Plan Finder. And some open enrollment facts and questions. If you enrolled somebody in a Part D or an MA Part D plan and they change their mind, can anything be done? Absolutely. You can enroll them in another plan. The last enrollment that they chose and they went through the process for is going to be the enrollment that takes place. Other questions that we get sometimes are, can I enroll a person in an MA only plan with no drug coverage and then get them into a separate Part D? The answer is currently no. We don't have any of those plans available in our area for folks to do that. So if they want a Medicare Advantage plan, it will come with that drug coverage. They will have to enroll in an HMO or a PPO and get their Part D through that plan. All right, Medicare Advantage plans and extra benefits. So Medicare Advantage plans, as you know, offer dental, vision, and hearing. That's usually the big thing that folks are looking for. But generally speaking, those dental, vision, and hearing offerings are a separate rider. So if a beneficiary is looking to change their Medicare Advantage plan and they have that separate rider, meaning they're paying an extra $20 to $40 a month for that dental, vision, and hearing coverage, then they will need to contact the plan that they had and cancel that rider separate. Likewise, if they really like that rider, they can call and ask, hey, if I switch my Medicare Advantage plan, can I keep that rider? Whether the company allows them to do that or not is up to them. We can't say, but that separate rider will need to be canceled separately from doing a new enrollment on Medicare Plan Finder's website. Some new extra benefits that are listed on Plan Finder, so you'll be able to view whether or not that Medicare Advantage plan offers this, are some fitness benefits like silver sneakers, transportation. Sometimes they offer transportation to healthcare facilities, telehealth, and more. So you'll be able to view all of that on the Plan Finder. Okay, if we encounter a Medicare Plan Finder problem, first thing we need to do is do some triage. So first and foremost, let's rule out any issues that may be taking place within our computer or our computer's network. You know, the bandwidth for Plan Finder sometimes runs slow during the peak times, which is 11 a.m. to 5 p.m. So let's try to also, if we can, mimic the issue. So if we see that the issue happens more than 3 times, then we need to report that. So there are Medicare Plan Finder intake forms on ShiftTools. Us site coordinators also have access to that for you as well. And what we need to do is fill that form out together with the site coordinator and then send it to the site coordinator for us to send to Lansing. Lansing has requested that we don't have the volunteers contacting them directly. because there's just so many volunteers in the state. That's a lot of emails to get, especially during open enrollment period when we're going to be experiencing a lot more potential issues with Medicare Plan Finder. So just please make it a point to reach out to your site coordinator for anything like that you would want to reach out to Lansing for, so that we can do that on your behalf. All right, let's get into the thick of Part D. So here is your standard drug benefit. In 2021, majority of the plans are going to have a deductible of $445. There are some plans that have higher premiums and lower deductibles or no deductibles at all, but the maximum deductible for plans in 2021 is $445. For somebody in their initial coverage limit, that number is $4,130. Then they're going to enter into that donut hole and they have to pay a maximum out of pocket of $6,550. And then once they're in their catastrophic coverage, the minimum cost sharing is going to be $3.70 to $9.20. In that gap or donut hole, it is across the board 25% regardless of a name brand or a generic. If somebody needs a Part D penalty calculation, that national base premium this year is $33.06. And for those with extra help, the co-payments are, if they're receiving the Medicaid or they're at the 100% federal poverty level, $1.30 to $4. For anybody who's receiving full extra help, it's $3.70 to $9.20. If they're receiving partial extra help, they will have a deductible of $92 and a copayment of 15%. And then the LIS benchmark premium. So if somebody has LIS and they want to jump into a Part D plan and not have to pay a premium, they need to be in a plan that is $30.08 or less. All right, so here's that benefit structure in graphic form. So again, everybody's expected to pay their monthly premium if they have one. And plans have up to, I apologize, you guys, I don't know why my slides are doing this, but they're making me crazy. The plans have up to a $445 deductible for the year. They will then enter into their coverage level where they're expected to pay no more than 25% of their meds. And that's if it's like a top tier level medication, right? Otherwise, they have whatever the plan's copays are. And generally, I would say probably most of the plans, if it's a tier 1 preferred generic, they are going to pay a very minimal amount out of pocket. But once the insurance has been billed up to $4,130, that's when they're going to enter into that that donut hole gap coverage level, where they're going to be expected to pay 25% of the medication cost regardless of whether it's brand or generic, until they've paid either $6,550 out of their pocket, or until the insurance has been billed $10,048.39. Once they have paid up to those amounts, then they're going to enter into that catastrophic coverage phase where they're only responsible for 5% of the cost of those medicines. All right, again, donut hole gap coverage, 25% across the board. So doesn't matter if they're getting a generic or a brand, it's 25% of that cost. And here's a look at what the coverage gap had been prior. You know, they had been saying they wanted to, as they worded it in years prior, they wanted to get rid of the donut hole. In actuality, they wanted to level it. So now, instead of paying 45% like they were in 2015 for a brand name drug, they're paying 25% for 2021. And then for generics, instead of paying 65% like they did in 2015, they're going to pay 25%. All right, late enrollment penalty. So if you encounter somebody who did not have creditable coverage and did not enroll in Part D when they were initially eligible to, they are going to pay a late enrollment penalty. The penalty is added into their monthly premium and it will continue the entire time that the beneficiary is enrolled with Part D. It's calculated by taking 1% of the Part D base beneficiary premium, which is $33.06 for 2021, for each month that they did not have creditable coverage and did not enroll in Part D. So important thing to let beneficiaries know is that this amount is going to change each year because the beneficiary premium changes each year, that base beneficiary premium. But to calculate that, if someone had never enrolled in Part D when this late enrollment penalty started, which was June 2006, you're going to calculate it in months. So you know for sure that June through December of 2006 is 7 months. Then you're also going to look at from 2007 through 2020, which is 13 years or 156 months. So you're going to add that 156 to the 7 months from 2006, giving us 163 months. That should say 163% times 33.06. And that would give the 2021 monthly penalty to be $53.89. Social Security will also alert them of this information. So you don't have to sit there and do the math. You can just inform them that there will be one and to look for that from Social Security as well. But in case you're wanting to do the math, that is essentially how you would do that. All right, Part D Irma. So Part D premiums are subject to income adjustments just like Part B premiums. And beneficiaries with significant income will pay a sliding scale higher Part D premium. It is based on their IRS tax returns from 2 years prior. So for 2021, they are looking at 2019 tax returns. There are 6 income categories, and each category has a set dollar amount associated with it. This is the Part D Irma information for 2020 because the 2021 Part D Irma information will be released when we see that COLA and the Part A and B information. Again, Social Security will notify the beneficiary of this information and will do the calculations based off their IRS returns. If a beneficiary is in a completely different income category for 2021 because of a life change, they can appeal this decision with Social Security. There are forms available for them to do that, and their letter should also inform them how to do the appeal as well. But sometimes things can change in a couple of years. So if they're stressed out about that, that is something that we can advise them on. Okay, so LIS and extra help. Income thresholds are based off the federal poverty level. Those federal poverty levels will be announced in January. However, they will not be effective until April 1st, 2021. So if somebody is eligible now, they will remain eligible for 2021 as well. Let's take a look at some of the specifics on the plans. There are 29 Part D plans for 2021. Of those 29, 18 of the plans are enhanced, meaning that they offer extra benefits, which might be more medications on their formulary list. There are 11 basic plans. There are 4 plans that have a $0 deductible. Of those 4, the lowest premium for the 0 deductible plans is $65.10, and that would be with Silver Script Plus. There are 9 plans that are under a $25 monthly premium. The lowest Part D premium is $6.90. That is with Silver Script Smart RX. The highest Part D premium is $109.30. That is with Prescription Blue Premium. And the average Part D premium is $38.57. There are 3 Part D plans that do offer gap coverage. The lowest cost plan with the gap coverage is $39, and that is with Mutual of Omaha RX Value. These are your PDP plans that are within the LIS benchmark limits. So If somebody doesn't want to pay a premium because LIS will pay it for them, these are the plans to look at. Also, there are 7 national Part D providers. That information is in the notes section of these slides as well, but that would include Aetna Medicare, Cigna, Elixir, Express Scripts, Humana, United Healthcare, and WellCare. Okay, special needs plans. So we have quite a few available, but there are special need plans for specific reasons. You do have plans for chronic illness. Likewise, you have special needs plans for those that are institutionalized. So anybody who's in a nursing home or anything like that. And then you also have those plans available to dual eligible only. So they'd have to be full Medicare, Medicaid. There are 8 plans total for Livingston, 10 plans total for Macomb, 5 plans for Monroe County, 14 for Oakland County, 4 for St. Clair, and 8 for Washtenaw. All of the plan names are listed in the notes on this slide. So when you get the slide, you'll be able to view those plan names. All right, marketing guidelines. So Medicare Advantage and Part D plans cannot do certain things to market. They cannot market themselves as Medicare endorsed. They cannot solicit door to door. They can't market outside of their service area, and more. So if you encounter a beneficiary that experienced any of these things, we can report that to Lansing. So connect with your site coordinator to report those things for them. We're going to take a look at Medigap now. So Medigap Basics, we still have those standardized plans, A, B, D, G, K, L, M, and N. Rating methods are the same as before: community rated, issue age, age attained. The enrollment periods for Medigap plans, essentially they can make Medigap plan changes anytime they want once they have one. The biggest thing is if they do it anytime and they aren't in an open enrollment period, so the first 6 months that they were eligible because they had just enrolled in Medicare Part B, or if they aren't receiving a guarantee issue because of an involuntary loss of coverage or the trial right that they have when trying a Medicare Advantage plan, then they would be subject to medical underwriting. And if they're subjected to medical underwriting, that can, of course, increase the price of their Medigap policy when they take it. But those changes can happen anytime for them. It does not have to be during open enrollment season. Also, not all Medigap plans have to sell to somebody who's under 65 with a disability. If a beneficiary is under 65 with a disability and then they turn 65, they are eligible for a Medigap open enrollment period and they can switch their plan. So if you encounter, a situation like that, make sure that they know that they can do that because it will save them a significant amount of money. And it may also provide them better coverage. Okay, so effective as of this past open enrollment season, or January 1st this year, beneficiaries who were new to Medicare, so they had aged into Medicare as of January 1st, 2020, were not eligible to purchase Medigap Plan C or F. That is still true. If somebody is new to Medicare and their birthday is on or after January 1st, 2020, they can purchase plans D or G, which are the alternatives to C and F. There is a high deductible G plan available if somebody is interested in that alternative. They can do so. Those that are currently enrolled in Plan C and F can keep their plan if their plan is offering that. They don't have to change just because now D and G are the new C and F. This happened because Congress wanted to level the playing field. They didn't want to have to pay that Part B deductible. So they took those plans away from new beneficiaries to Medicare. If you'd like to see more information, you can do so on page 72 of the 2021 Medicare New Book. This is a copy of that page, and it just shows you the plans. Also, the asterisk here for F and G means that there's a high deductible portion plan there. So there's a high F and a high G. If you encounter a beneficiary who was eligible for Medicare before January 1, so their birthday and they turn 65 before January 1, they could technically still try to purchase a C or an F plan, which is why those are still listed there. But for anybody who's 65 as of January 1, 2020, C and F are not an option. Okay, so there is a subsidy to help pay some of that Medigap cost. That is the Michigan Medigap subsidy through the Michigan Health Endowment Fund. In order to qualify for that, the beneficiary must be a Michigan resident. They must be within the household income levels. So if they are a single individual, they cannot make more than $28,710 a year. And if it's a couple, they cannot make more than $38,790 a year. There are certain plans that accept this subsidy. Those plans are AARP United Healthcare, Blue Cross Blue Shield of Michigan, Blue Care Network, McLaren Health, and Priority Health. If somebody is in a plan and it's not one of those, unfortunately, the subsidy would not qualify for them. The Michigan Medigap subsidy has recently reduced their monthly premiums because they've extended their program through the end of 2022. So now if somebody is 65 to 75, they will receive a $25 subsidy. If they're older than 75, they will receive a $45 subsidy. And if they are disabled and under 65, they will receive a $75 subsidy. They can apply by calling the 866 number for the Michigan Medigap subsidy or going online to michiganmedigapsubsidy.com. Also, something to note for you guys is that no new applications are going to be accepted. There's been some conflicting information on their website. At first it said January 12th, and then there was another spot that said January 4th. A good rule of thumb is there's just no new applications being accepted January 2021. So they've got roughly 2.5 more months to get a subsidy application in before that's not an option anymore. So how to shop for a Medigap plan? Well, certainly the things to consider is somebody in their open enrollment, so their first 6 months of having Part B? Are they under a guarantee issue? What's their health status? What's their age? What type of Medigap plan are they looking for? So what kind of coverage? What's their budget? And how's the customer service with that plan? There are resources on ShipTools. Of course, you've got the ShipTools Medigap Plan Finder. You've got Medicare.gov's Plan Finder, which we would encourage you to use the ShipTools Medigap Plan Finder. There's also information through Michigan's Department of Insurance and Financial Services, also known as DIFS. And then there's also information on Michigan's Association of Health Plans. Okay, I really wish these slides would stop moving so fast for us. Sorry about that. Some counseling tidbits. Okay, this is a really, really important thing for you guys to know. The cost share savings, or those calculations of savings for box 6 and 32, are now so more important than ever. You have got to do those calculations, and you have got to push button 6 or 32, and you have got to check all the boxes, because calculating those savings is how we are poking the bird. There is no more bird to poke on an application. So if you don't fill in box 6 or 32 and you do an enrollment, our funders and CMS are going to think that we aren't really actually assisting in enrollments anymore. To calculate those savings, you will look at the difference between the 2021 cost for that current plan that they're in and the 2021 new plan that they're looking to enroll in. Also, if they're new to Medicare, we will calculate their savings based off the retail cost for those meds that they plug into their med list for 2021, and then what that new plan's coverage will provide them for 2021. We are going to do a walkthrough together on this here in just a few minutes, but this is very, 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 very important. I don't think I can stress it enough. Super important. If we want to have the MAP program still here, we have got to make sure that we are showing them what we're doing, and this is the way that we're doing that now. Likewise, if you do an LIS enrollment or an MSP enrollment for somebody, you need to check the appropriate box. The amount of savings will auto-populate in the box for you. Okay, some other reminders. Absolutely make sure you report in Shift Tools. If you want credit for what you've done and you've put a lot of hard work into this, absolutely report that. We want to make sure that you get all the credit you deserve for the awesome job that you are doing. This program and the help that we provide couldn't happen without you. So let's make sure that we're showing them how amazing and invaluable you guys are. Also, make sure to incorporate fraud education into your counseling with every client. It is super easy. It can be as simple as, hey, there are some COVID-19 scams out there. People are trying to call pretending to be contact tracers. If you were really actually in contact with somebody who had COVID and a contact tracer called you, they wouldn't ask for your social security number or your Medicare ID number or your credit card number or your bank account. It can be super easy and organic in a conversation. Please make sure that you're doing so and that you check the boxes accordingly. Also, if you haven't already signed up to help at a Medicare open enrollment event, please make sure you contact your site coordinator to get connected in that capacity. And then lastly, for those of you who signed up for Zoom counseling, your site coordinator will send you a Zoom license login with your schedule for your open enrollment appointments. So let's say you're counseling on the 15th, your site coordinator will send you that schedule and then tell you, hey, you're going to log in with this email on zoom.us's website, and then you'll see your meeting right there, and all you have to do is click start. It'll be very simple, very easy, and if that's something you guys are interested in seeing a walkthrough of today as well, once we go through the Part D Senior Savings Model Med List and the cost share savings process, we absolutely can do that too. Now we're to the point of questions. Before we jump into questions though, I do want to take a minute to just show you guys what we need to for the cost share savings really quick. So let me get you guys to my website here. Okay. When we're doing open enrollment, we are going to go to medicare.gov. If you are looking for a 2021 plan, you certainly are going to want to hit the preview 2021 health and drug plan box. If you're looking for 2020 plans, you want to come down here to where it says need a 2020 plan. If you end up looking at plans and it automatically switches you from 2021 to 2020, there is a link on the webpage that can switch you back. For all intents and purposes for today, I am just going to continue to log in without a login name. I'm going to look at Part D plans. I'm just going to enter in a zip code that I normally deal with because it's easy. All right, and then I'm going to select that they don't get any help from any other programs, Medicaid, supplemental, anything like that. Let's plug in a medication here. And retail pharmacy. All right, so first thing I want to plug in is going to be, can you guys see my screen again? I'm gonna unmute one of you organizers, just let me know. Can you guys see my screen again?
Yes, Melissa, no problem.
Okay, it told me it stopped sharing for a second, so I was worried. Thank you. Okay, so we'll just type in levothyroxine because that's a pretty simple common one. And then we'll type in, we'll go with the basic. We'll also type in Novolog. We're not going to add the generic. We're going to add the brand because the brand is part of that list. We're going to do the pen injector because that's part of that Part D Senior Savings Plan list. We're going to add it to the list of meds. Let's say this is all they take. We're going to click Done Adding Drugs. We'll plug in a couple pharmacies. Let's try just some like popular ones, Kroger, CVS, Walgreens. All right. So when you get to this screen, if you happen to be viewing 2020 plans and you don't see 2021, at the left corner here is where it's going to tell you what you're viewing. So right now we're viewing 2021 plans, which is what we want. And if you want to see the other, then you just click the hyperlink that says. So if we were on 2020 plans, we would click the hyperlink that says show me 2021. Over here is our filter underneath the print box. If you click on filter plans, it's the green button. There's a little box that says insulin savings. Check that box and it will filter for plans that are part of that Part D senior savings program. So first plan that we see is WellCare Wellness. Just move this out of the way here. Okay, we're going to add that to our comparison. And then we can add, let's add Humana because it's just a different company. And compare. All right. You got to keep moving something out of my screen here for me. Okay, so the WellCare Wellness RX plan, when you're doing your comparisons, let's say that they were in Humana and now they want to go to WellCare. What you need to print for your cost share savings is the print button that's at the top left, or I'm sorry, top right corner here. If you don't see a print button, you can click on your keyboard, Control, which will be CTRL, and the letter P, and it will prompt a print box to populate. Or if you press the print button, a box will populate as well. This box shows you what your printing is going to look like. It will show you next to destination how it's going to print. So if I were printing from one of my printers listed here, I could select that or select Save as a PDF. Select Save as a PDF to save it to your computer so that you can email this to the beneficiary if you'd like, but also so that you can have it for your client contact form, okay? So we're gonna click Save at the bottom because we wanna save it as a PDF. And now a file folder, let's see. We're just gonna share my screen here. There we go. Now the file folder pops up for me and I'm gonna save it to, because I had one for you guys. I think it was this one. Okay, I'm gonna save it to this new folder here. We'll just call it that. No, we won't. Okay, we're just gonna save it to our documents here. So let's say this was John Doe. We're gonna go J Doe, and you can put in there comparison if you want, or if it's because it's a Part D plan with a Part D plan, you can just label it comparison. If you have to do an MA to a Part D, then you're going to be doing plan details for it. So for all intents and purposes for today, we're just going to label it comparison, and then we're going to do 10, 20, 20. If I can type today, that would be great. Okay, so we're going to save it like that. And so now we know that because they're enrolling into this WellCare Wellness and they were in the Humana, let's say their pharmacy of choice is going to be Kroger. You're going to look at what the 2021 cost would have been for them at the Kroger pharmacy. That would have been $1,140.15. So when you're in your Ship Tools, go to Ship Tools here real quick, and you're in your client contact form, you'll plug in all the necessary information like you need to, because you want to make sure this is complete. If it's not complete and it's incomplete when you're done, it will make you upload all the documents all over again. So make sure everything is complete. So I'll click on box 6. I need to click on this before and after comparison on file and the enrollment confirmation on file in order to enter any savings info. See how it's blocked off there? So I'll click on before and after comparison on file and then enrollment confirmation on file. When you are putting in a comparison that is a Part D to a Part D or an MA to an MA, you can use that same comparison form like that we just saved for both. It does not need to be different. Just make sure that you make note in your file that, or in the note box, that they switched from Humana to WellCare Wellness. Now let's look up J Doe, and we're going to click open. Okay, to get that file in there, I clicked on choose file, and we're going to go J Doe, and we're going to click open. Wherever you need to place that file folder in your computer so that you know where it's at, put it there. It's totally okay. Just make sure that you know where it goes so that you know where to find it. Likewise, if we had an enrollment confirmation, we would click choose file again and go through that same process. We need to make sure we plug in the date we did the enrollment. So if it's 10/15/20, then we're entering in 10/15/2020. Or you can just go where the calendar is and click on the date. Okay. Now we can plug in that before and after number. So if we defer back to our comparison and they were in Humana Premier RX plan and they were going to Kroger Pharmacy, that number was $1,140.15. So $1,140.15. The after is the new plan at the Kroger Pharmacy. So $612.90. That's a $527 savings that is very important to inform our funders of so that we can receive grants to keep running our program. Now, if you want to see the Part D Senior Savings Plan in action, click on the plan details for the plan that you're interested in. When you scroll down to the pharmacy, so let's scroll down to Kroger, you can see that the Novolog typically would be a retail cost of $590.53, but because it's a part of that Part D savings plan, and because this WellCare plan participates with that, that insulin is only going to cost them $35 a month, regardless of deductible phase or not. So they should be good. And it includes that in that coverage gap as well. So when they'd be in that donut hole, $35. It's a huge savings for beneficiaries. And you can see that reflected too in their estimated monthly drug costs. Now, if you're looking at just these numbers to plug in that cost savings information, this is just for the monthly drug costs. So that's why you want to make sure that you look up where it says estimated total drug and premium cost. That's $612.90. It includes the premium of $15.10 per month with that estimated monthly drug costs. Okay, so that is it on that Part D savings plan. And that is also it for the cost share savings documentation portion. Again, if you need help with this, site coordinators are able to assist, but again, that Part D Senior Savings Plan is under the filters. It is just a checkbox that says insulin savings, so you want to make sure you click it. You can view it for Advantage plans. So here, we'll do this. Let me move this really quick. If you want to switch to Medicare Advantage plans, there's a blue hyperlink that says View Available Medicare Advantage Plans on the top right. You can click that. It'll switch you over. You can click on Filter Plans again, check on the insulin box, and then Apply Filters. And then you'll see the plans that are offering that. So in Washtenaw County, you've got 15 plans that are Medicare Advantage offering that, okay? This is a huge deal for our beneficiaries, so it's really, really, really great, and it's, I don't know, something I thought was pretty cool. Okay, so now we're gonna open up the questions. I'm gonna stop recording